Oh no, don't close that door.
Oh, you don't want to check? Oh,
It's hot in here. Did you turn it down all the way? So.
Yeah, they turned it down.
Okay. The other thing, we have our patients who had surgery last week. Good. And we're going to take your staples out. If you're willing, a lot of you have some interesting stories, like we have, I know, a former diabetic here. Is that right? And how are you doing?
My blood sugar is great. I was diabetic,
yeah.
And my blood pressure is down. I had high blood pressure, and I have not been medicated.
So it would be great to get a little 2-minute story on you guys, if you don't mind, talking about it. We have one of my favorite kinds of patients, which is an ex-lap bander. So if you want to say a word on the video to other lap band patients around the world, that would be, I think, might help somebody. You know,
it's been great. The post-op experience compared to what I've been through before has been horrible.
Right, you had that post-op pneumonia.
I had post-op. I had the band removed in 2002. I actually had the band from 1991 to 2002. And when I had the band removed in 2002, I caught pneumonia twice from that surgery, and just had a lot of, it was just unreal getting over not just the pneumonia, but just the surgery in itself. So this has been great. You know, the post-op experience has just been a breeze compared to what I've experienced with the band.
Good. With that, we definitely want her on tape. And of course, we also have a revision. So hopefully you've done okay this week. I was hearing about all the shows while we were starting, so that sounds pretty good. But if you will think about it, we're going to do our patients from last week and talk about their experiences. If you're willing to be on the videotape, we'd love it. If not, don't worry about it. We'll go ahead and turn that off. We understand there are a lot of people who prefer not to kind of have their face all over the internet with millions of people looking at them. And I'm a different kind of person. I guess I have millions of people looking at my face all the time, and I'm all right with it. But think about it this morning, because you might get a chance to help somebody else. So it's something we'll do. Then we have our patients who are from the past. We like to talk to them, and if you want to say a word on tape, that would be great. And then we have our patients for this coming week. Good morning. Good. And we're going to talk with you all a little bit. And then we might have people who just got lost and are here by mistake. They're just listening, and they happen to be here by error. They thought this was the conference on how to make money with Donald Trump, and no, that's in the next conference room. But we'll talk with you all last, take a few minutes, but we think you can get an advantage by listening to all the other people who've been through the surgery. So